Today we're going to talk about inflammatory breast cancer. Number one, it is a clinical diagnosis. It includes breast erythema redness, which is acute onset, less than 6 months, and you have what is called a purely orange appearance of the breast, and you may or may not find a breast tumor. If you do find it, biopsy it, and that will show that there is cancer in it, or you may biopsy the skin, the dermis, which would show that there is tumor infiltrates, which is causing lymphatic obstruction. NCCN says inflammatory breast cancer is a clinical diagnosis because you may not need any of this to make the diagnosis. The history may be sufficient to make the diagnosis. However, for the purposes of the exam, I'm sure there will be scenarios where the clinical history followed by a tissue biopsy will be given to make the diagnosis. So if you have a patient with an inflammatory breast cancer, should you stage the patient? The answer is yes. For an advanced breast cancer, you should stage the patient. NCCN guidelines do not recommend staging for usual breast cancers. It's actually discouraged. So how would you stage this patient? CT scan of the chest, abdomen, pelvis, LFTs, bone scan, or a PET scan. So this would be the workup. Now, what surgery would you perform? Well, before surgery, this patient would get chemotherapy, followed by surgery, and followed by radiation. Now, what surgery would you do? This patient would undergo a modified radical mastectomy, which would mean mastectomy, and level 1, level 2 axillary lymph node dissection. So lumpectomy or breast conservative therapy is the wrong answer. Sentinel lymph node biopsy is also the wrong answer. After surgery, you usually give radiation. If you have not completed the chemotherapy dose prior, you can add that to this. What else can you do? You look at the tumor biology and pathology. If the patient is ER/PR positive, you can do hormonal therapy. And if it's HER2 positive, then you can do the HER2 therapy as well. Now, would you reconstruct this patient? The answer is no. The chances of local regional recurrence is very high in these patients. So NCCN recommends a delayed reconstruction in these patients. Thank you.